I never miss an opportunity to talk about our amazing initiative that Lakeridge Health has embarked on over the past year. We have, as an organization, really focused on our seniors, and we focused on getting people moving when hospitalized. And we're taking away the patient. We're stopping looking at people as admitted patients and people who are sick, and we're moving towards looking at being admitted as part of your healing journey, and that this is who you are. So if I was standing up here in a hospital gown, I don't think I'd be able to talk to you. I'm having enough time right now with the back feed. But I think I would really struggle. Part of who I am is how I present to you. So think about a time when you were in a hospital gown, whether you were an admitted patient or you were getting a test. Did you feel empowered? Did you feel like you were ready to take on charge of your own care, to get up or move around? I don't think that we do. And that's what we do to our patients, our people, when they become admitted into our organization. We remove the personhood from them, and they look like everyone else. When I look out of over the audience, I see a variety of different people here. And we need to empower our people to remain people when they're part of Lakeridge Health. So we've done really well in doing this initiative, and it really helps support our mobility. We've really embarked on having all of our admitted patients have 3 or more mobility events in a day. And part of that is being dressed and enabling people to do that on their own. I think that when we were talking about everything we're looking at here is really moving from sickness to health and looking at creating a culture of healing, encouraging patients to, I'm going to take a pause here and just go back to talking about what I want you as community members to do. So when you have your loved ones admitted to the hospital, bring in clothes. Encourage your loved ones to get up and get dressed and get moving, looking for loose-fitting clothes and really being part of their healing journey. Okay, so we've all seen how something as simple as mobility can have an impact on a hospital stay. It can have a powerful impact on the recovery, dignity, and mental well-being, especially as we age. But healthy aging isn't just about the body. It's also about keeping our minds sharp and resilient. That brings us to a crucial topic, which is brain health. Protecting our cognitive function is just as important as maintaining the physical mobility. So as we're talking about being perimenopausal, I think a lot of us would relate to this topic. Have you ever walked into a room and forgotten why you were there? Have you ever searched for your phone while you're holding it? Looked for your glasses while they're on their face? All these small moments of forgetfulness can feel frustrating, but they remind us the importance of caring for our minds. Every 33 seconds, someone loses their life to Alzheimer's disease. Mortality rates are climbing, and nearly 70% of those diagnosed with Alzheimer's disease are women. Dementia has now surpassed cancer as the most feared disease, and with no known cure, the concern is very, very real. But here's the good news. Research has shown that approximately 40% of worldwide dementias are linked to modifiable risk factors, things that we can control through many of our own choices. Dr. Francis touched on many of those, which perhaps we are going to take with a grain of salt, but it is important to look at our brain health and see what we can do in order to keep our brain active and engaged as we age. As women, we juggle countless responsibilities. I see you here tonight, and I love that people have brought their babies, their children. Some people brought their husbands. We have countless responsibilities, excelling at work, raising children, and caring for aging parents. But with so much on our plates, it's easy to put our own well-being last. But prioritizing our brain health is not a luxury, it's a necessity. The key lies in building a lifestyle that supports the body and the mind. Simple and consistent actions can make a difference. So if we look at the 6 pillars of brain health, we look at exercise, balanced nutrition, stress management, social connection, mental stimulation, and quality of sleep. These all play vital roles. By focusing on these 6 pillars, we can actively reduce our risk of cognitive decline and build stronger, healthier brains as we age. So let's take charge of our brain health today, because a sharp mind isn't just about memory, it's about living a full, independent, and vibrant life. So when we talk about cognitive brain health, it's not something we really think about. And so what does that mean? How do we actually exercise our brain? It's interesting because research has shown that 30% of older women actually have brain changes that are consistent with Alzheimer's disease, but they're not showing symptoms. And what is the difference between those women and the women that actually are showing the symptoms we associate with Alzheimer's disease? So forgetfulness, they're reliant on others for their day-to-day activities. And it's called cognitive reserve. So this is the brain's ability to adapt and compensate. So cognitive reserve is built through lifelong learning and mentally stimulating activities. Things like higher education, attending events such as this, challenging work, learning a new hobby, learning a new language, or even doing challenging puzzles. These aren't just hobbies that we do, they're really protective tools for our brain. So as much as we prioritize our physical health, it's very important that we challenge ourselves to keep our minds strong and resilient. So this Brain Fit app, that's Canadian made, very important, is an app designed to help women ward off dementia. This app promotes brain health by promoting daily and weekly habits like drinking water, learning a new language, or engaging in challenging activities. So healthy aging for women starts with small intentional choices, moving more, connecting more, challenging our minds, and seeking support when we need it. So as we talk about keeping our brains active, it's important to recognize the context in which many of us are trying to maintain this brain health. For a growing number of people, that is the caregiver. And as I just mentioned, many of us I see people on their phone, calling their kids at home, talking about dinner that's in the microwave, and everyone's adapted to be able to be here tonight. So you've made the first step in making a commitment to you. And it's so important that while a caregiver is caring for a loved one, they also remember to care for themselves. So in Ontario, more than 4 million people are caregivers. They're caring for a family member, a friend, a neighbor, and almost 3/4 of them are women. The average caregiver is a 49-year-old woman who works outside the home and still spends 20 extra hours providing care. While women take on this role with the best of our intentions, we often quite easily become overwhelmed and exhausted. A recent survey in Ontario alone found that 44% of caregivers were very unprepared for the demands that the caregiving would place on them in terms of professionally, emotionally, and financially. Many people don't anticipate the full impact that caregiving puts on them, that puts on their families, that takes their time financially and professionally. Women who are caregivers are more likely to experience poor health. They're more likely to report mental distress and experience severe anxiety and periods of depression. So I imagine some of you in this room can relate to these words. You're feeling the weight of caregiving right now, navigating the emotional and physical demands that come with supporting a loved one. So here on the screen is an amazing resource that we have in Ontario that really is underutilized. It's the Ontario Caregivers Association organization. So this is a 24-hour, 7-day-a-week support system for caregivers. They have helplines, peer support programs, free counseling, online learning, and guidance for navigating the healthcare system. If someone is new to caregiving or if they've been in the role for a while, they make sure that no caregiver feels alone or unsupported. So caregiving is a journey that no one should have to navigate in isolation. By seeking support, sharing the responsibilities, and utilizing available resources, we can create a stronger, healthier caregiving community, one in which both caregivers and their loved ones, I've got the time here, feel that they can survive. So again, I just want to take the time to thank you for being part of this important conversation and for committing to yourself for being here tonight. For as women, learning about what resources are available in Durham, learning what Lakeridge Health can do for you, and learning how we can grow together.